So my subject today is dentist-patient relationship and level of satisfaction among Saudi adult population seeking dental care at King Abdulaziz Medical City. My name is Abdullah Al-Dahash. I'm a student at King Saud bin Abdulaziz University for Health Science Dental College. So with the outline of my presentation, we will have the overview of the research, introduction, literature review, methodology, result, discussion, and conclusion. So the topic, as we said, dentist-patient relationship and level of satisfaction among Saudi adult population seeking dental care at King Abdulaziz Medical City. It is a cross-sectional study. Our primary goal is to investigate the level of satisfaction and the effect of gender, education, and income on the overall satisfaction. And our secondary goals is to assess the preference of patient toward dentist gender and to measure the waiting time for appointments. Why satisfaction is important? Because satisfaction will influence the compliance of the patients, which will affect the treatment outcome of the procedure. So in order to be professional dentists, we consider patient satisfaction as one of our top priorities. Interaction and communication skills are two essential elements that help to build up a successful dentist career. In order to, we found that nowadays healthcare is undergoing a revolution where satisfaction of the patient need is a part of definition of quality. Hence, commitment to provide a high quality service and achieving patient satisfaction become important issue in the dental healthcare provider. So in our methodology, as we said, it's a cross-sectional study. We conducted it at King Abdulaziz Medical City dental clinics. We include follow-up patients aged 18 and above. We exclude mentally challenged patients. And our sample size is 129 participants. We distributed an Arabic questionnaires consisted of 15 questions. The questionnaires. The first 4 questions were about gender, age, and socio-economic status of the participant. Other questions were to measure the appointment, time spent in the waiting area, and the time spent waiting for the appointment. Some questions were meant to measure the doctor courtesy, knowledge, and quality of treatment. Others were to measure the patient satisfaction with the quality of treatment, service offered by the dentist, health team, and overall satisfaction. So in this table, we see that there is almost 58% of the participants were female. Almost 60% of the participants were aged from 18 to 45. Only 10% were above 46. And in level of education, most of the participants had a high school diploma or higher education bachelor degree or above, with a 43%. Monthly income, we found 30% of the participants had a monthly income of 5,000 riyal or less. So in result, level of satisfaction of overall services, 52% agreed, and strongly agreed 25%. In sum up, almost 77%. As we said, we will measure the effect of gender, education, and income. In gender, we found that female were more satisfied with a p-value of 0.034, and we found that higher education have a lower satisfaction levels with a p-value scores 0.003. And we found no significant relation between the higher income or lower income. Preference of patient toward the dentist gender. We did a chi-square test to determine the preference of patient toward the gender of the dentist. We found that 60% of females preferred a female dentist and 35% of male preferred a male dentist, and the rest had no preference. And the waiting time, 32% of the participants waited from 1 week to 1 month to get the appointment. So in discussion, in our study, 78% of the participants were satisfied with the overall satisfaction. In contrast to another study was conducted at the dental clinics of the colleges of dentistry at Taiba University, it was noticed that the majority of interviewed patients, 96.3%, were satisfied with the patient-dentist overall treatment. And after comparing the level of satisfaction for males and females, we found that females were more satisfied than males. Comparing this result to a study which was conducted in Western Cape, South Africa, to a sample size of 200, females also were more satisfied than males. After comparing the score of satisfaction of participants with higher education with those with the lower education showed that the participant who have higher education has lower satisfaction. In another study conducted at Najman University in the United Arab Emirates, there was statistically significant association between the level of education and the dental satisfaction scale. The most highly educated people are the least satisfied patient with the treatment provided. So we did a comparison between patients with higher and lower income, and level of satisfaction showed no significant in our study. But in contrast to this, a study was performed in UK showed that people with low income has less satisfaction levels. In conclusion, we have found that the majority of the participants were satisfied with the overall services provided at King Abdulaziz Medical City Dental Clinics. I would like to acknowledge my group members who worked with me in the research: Amr al-Samahi, Salih al-Khashan, Muhammad al-Isa, Muhammad al-Salim, Walid al-Faiz, and our group advisor Ashraf al-Mitwalli. Thank you for your patient listening.
Thank you. Thank you so much, Mr. Abdullah al-Dahaj from King Saud Abdulaziz Health Science. Any question? Any question to Mr. Abdullah? No questions?
Thank you.
Thank you. Thank you so much, Mr. Abdullah, again.